Well, thank you, and thank you to the committee for the invitation to speak to you today. I'm going to talk about work we've been doing in the UK about how to evaluate interventions using a complex systems approach. I'll introduce that by talking about guidance that we've had in the United Kingdom that was initially published in 2000 and has been updated since then. And I've recently been working on a further update to that guidance, which isn't published yet, but I'll return to that at the end of the talk. But in 2000, it was recognised that we were trying to evaluate these more and more complex interventions, and the first guidance that was published really tried to borrow the kind of stages of research that were done in drug research and to kind of translate them into the assessment and evaluation of more complex interventions, whether they be health service interventions or public health interventions. And this took a very kind of phased process in the same way that you have the phase 1, phase 2, phase 3 trials in drug research. Later updates of that in the bottom right of the diagram produced a less linear stage and recognizing there'll be iterations between each of the stages of the research process, but it was still really focusing on research that would really try to address the question of, does this intervention work? Is this intervention effective? Really research trying to find silver bullets of interventions that would solve increasingly complex health service and population health problems. But many of the most promising interventions can't really be evaluated in that way. So, for example, a major improvement in how services run or an introduction policy, you can't really evaluate that with a randomized trial answering a kind of simple what works question. Similarly, with complex population level policies, really difficult to evaluate that way, and that means our evidence base of strong evaluations doesn't have anything to say about some of those really important potential interventions. Also, there's the problem that those that are identified as effective in a controlled trial, so we do a trial, we find an intervention to be effective, but then it fails to replicate outcomes in the real world, and that might be because it's just simply not implementable in real world conditions, in the resource constraints of a real world setting. Or it might be that the situation is such that there's repeated failure to implement the intervention properly. Or it might be that it only works in very certain sort of contexts and it's not transferable across different contexts. So your supposedly effective intervention is only effective in a very limited number of settings. And then finally, it might be that an intervention that's worked and been found to be effective in a research setting, actually when it's implemented in a real world system, actually brings about kind of feedback effects and responses from the system that then kind of dilute the intervention. So although to some extent it's potentially effective, actually the system adjusts around it and therefore other effects emerge and that aren't beneficial. So essentially this kind of means that the stages of research that we have that have been based on drug trial interventions that have been adapted to complicated interventions have tended to produce a production line of effective interventions that very often don't actually work in the real world. So really, this might be a problem in the way in which they've thought about complexity. If we think about complexity in terms of the intervention itself, it might be that we think of a simple intervention, such as in this case, flat pack furniture. So wherever you are in the world, whether you're in the United Kingdom or the United States or Australia, you can go to your nearest branch of IKEA, you can buy flat pack furniture, say your Billy bookcase, and you take it home, you unpack the pack, you follow the instructions, which just have pictures to follow, no difficult language, and then wherever you are in the world, you will then produce the same bit of furniture, the same Billy bookcase. The exact design furniture will be reproduced in a highly standardized form. That is a simple intervention. But a lot of the interventions that we talk about as being complex interventions are really just an extension of that simplicity. So they're complicated, and one of the most complicated things you can think of is a rocket, the Apollo Saturn rockets that were sent up to the moon to land on or orbit the moon. They were made up of many, many parts, really, really complicated. But actually, once they had worked out how those parts work together, again, there was quite a high degree of certainty of the outcome. So as long as the weather was okay, the rocket would launch from Cape Canaveral, it would reach the moon, land on the moon, orbit the moon, and then return down to a fairly predictable part of the Pacific Ocean a few days later. So really, really complicated, but in a sense not that complex, because it was just a number of components that would act together in a predictable way. A good example of a really complex intervention is how you might raise a child. Now, I have 2 children, and I know for a fact that just giving the 2 children the same inputs does not produce the same outcomes. Those 2 children are very different. They've also had very, very different experiences. They have different friendship groups. Different things have happened to them that mean that they respond in a very different way to the same set of inputs that you give them. And so to intervene effectively in raising a child, you have to be adaptive, you have to be flexible, you have to throw away your formulae, and you have to recognize that what you do for each child at each particular time point must be adapted to the particular circumstances and responses and characteristics of that child. There is always an uncertainty of outcome, and there has to be a variation in practice. So interventions that we have in public health and in health services research are not simple, and they're not just complicated with many components. They're actually often very complex. And these complex interventions cannot be divided into discrete sets of actions with predictable, stable, and linear consequences like we can with a complicated or simple intervention, but often they involve emergent, unpredictable properties and non-linear associations between components and between those components and the wider environment. And they then generate different outcomes in ways we can't easily predict using standard linear experimental methods. And it's also important to recognize the complexity does not just lie solely in the intervention. So we can also have simple interventions that are really complex to understand in how they work, because they depend on, for their effects, they depend on how they interact into the wider system. So the same intervention, as I've already said, might not be transferable across different contexts, and that because it produces outcomes in ways that are highly dependent upon the context, on the specific health or education system or the broader social systems within which they're implemented. So a systems approach really recognizes that it takes the focus away from answering questions of effectiveness. It takes the focus away of just thinking about the intervention, but you think about the broader system, the system being a set of things that interact and are interconnected in many ways and produce their own patterns of behavior over time. And so our research question to try and identify things that are going to make a difference should be less about identifying what works, but actually identifying what contributes to improving the system in a positive way, and conceiving of interventions as interruptions in systems rather than just linear inputs and outputs. And if we do so, we understand that outcomes emerge from the interaction of the parts of a system in ways that cannot be predicted from the properties of the individual parts, and breaking it down into its individual entities won't really help us understand how that intervention is going to influence the whole system. And that means we tend to move away from one-off brief interventions to much more systemic, sustained interventions that are aiming to bring about change in these kind of either closed or open systems. Now, this is really difficult to do. There's lots of papers saying we need to think about interventions in this way. We need to take complex systems approaches to evaluation, but it's sort of easier said than done. So therefore, what we need to do is really think about how do we change the way we do our research? How do we change the way we set our research questions to produce more useful evidence that fits into this more realistic interpretation of how things happen in the real world using this systems perspective? So we need to develop research questions which take into account the wider contextual factors that influence an intervention. And we really need to encourage everyone involved in producing and using evidence, so researchers, funders, practitioners and policymakers, to develop, evaluate and implement whole systems